Good day everyone, this is Dr. Kelly from Silicon to Gynecologist. Today we'll be discussing infertility. What is infertility? Infertility is where a couple have difficulty getting pregnant, usually between 6 to 12 months after having regular unprotected intercourse. What are some of the common causes of infertility? On the female side, one of the more common causes is tubal occlusion, otherwise known as blocked tubes. Also, hormonal issues, and some persons who have polycystic ovarian syndrome or PCOS. Other things such as issues with the ovary. So, older women, after 35, the ovarian reserve or the ovarian function decreases. So on the men's side, so some of the common causes that will affect sperm count or seminal in general. So infection can reduce the sperm count. Also things like varicocele around the testes. And also hormonal issues can affect men, which will impact sperm count. So how do we manage and treat couples with infertility? For the female, we usually do blood works to check the hormonal levels just to make sure everything is fine. Also a pelvic ultrasound just to look on the female reproductive organ. And of course, check on the fallopian tubes by doing what we call a HSG to check to see if the tubes are patent or open to allow the egg to meet the sperm. So for the male counterpart, of course, semen analysis is the first step. Depending on the result of the semen analysis, one might need to do other blood investigations. So for persons who have hormonal issues, most times these can be treated with medication, and this is both for the female and for the male. If there's an issue, as we mentioned with blocked tubes, there is usually treatment we call tuboplasty that can help to correct the destruction of the fallopian tubes, but most times this is not very effective. Alright, so if both tubes are blocked, patient can be offered surgery to correct the obstruction, but most times this is not very effective, and the best way forward for a couple with both tubes being blocked is to offer them surgery to remove both tubes and then offer them IVF, which is in vitro fertilization, otherwise known as test tube babies.